Hello and welcome. I'm Leslie Hudak, and in this presentation, I will provide an overview of my Capstone project, Medicare Secondary Payer Questionnaire Essentials, an online course developed for healthcare patient access registration staff. The course is built around a learner-centered approach that emphasizes practical application, engagement, and accessibility. Because the target audience consists of busy adult learners with varying levels of experience, I designed the course using microlearning, multimedia, interactive activities, and UDL principles. My goal was to create a learning experience that was relevant, flexible, and immediately applicable to the workplace. During my needs assessment, denial trends, audit findings, and staff feedback, it revealed a performance gap related to inconsistent MSPQ questioning and documentation for patients with Medicare coverage. These inconsistencies can result in billing errors, claim denials, reimbursement delays, and compliance risks. To address this need, I developed an asynchronous online course in Canvas designed to improve patient access staff knowledge, confidence, and accuracy when completing MSPQ conversations and documentation. The course consists of two modules. It begins with a welcome page that introduces the course, outlines learning outcomes, provides instructor information, and includes a course overview video. Learners also have access to communication tools and support resources through both course modules. Each of the modules start with an overview page that clearly explains the objectives and connects the content to real-world job responsibilities. When designing the learning outcomes, I used Bloom's revised taxonomy to create a progression from foundational knowledge to workplace application. The course learning outcomes begin with factual and conceptual knowledge, requiring learners to identify the purpose of MSPQ questions, recognize common payer types, and explain how MSPQ impacts payer order, billing accuracy, and compliance. The course then advances to procedural knowledge, where learners practice accurately asking MSPQ questions and documenting patient responses. Finally, the course includes a motivational outcome focused on increasing learners' confidence and perceived value in conducting MSPQ conversations. This scaffolded approach helps learners move from understanding concepts to applying them effectively in their daily work. To structure the learning experience, I use Gagne's events of instruction. Learners first gain attention through videos that discuss realistic patient scenarios and illustrate the consequences of inaccurate MSPQ completion. Learning outcomes were introduced to establish expectations and help learners understand the relevance of the material. New knowledge was presented through instruction, job aids, and examples that support real-world application. Opportunities for practice were provided through knowledge checks and scenario-based activities with immediate feedback. Learners then could demonstrate mastery through authentic assessments that mirror workplace tasks and job aids and reflection activities that encourage the transfer of learning back to the job. Module 1 focuses on foundational MSPQ concepts and introduces several interactive learning activities. One of the first learning activities is a 7 TAPS learning experience that provides concise instruction on MSPQ basics through an AI-generated video, curated resources, and an embedded knowledge check. I selected microlearning because it allows learners to review information in manageable segments while maintaining engagement and reducing cognitive overload. Also in Module 1, MSPQ Registration Assistant, which is an interactive chatbot created in ChatGPT and allows learners to ask questions about MSBQ requirements, payer situations, and registration best practices. This provides learners with immediate responses and encourages self-directed learning, giving learners the flexibility to explore content at their own pace. To further support engagement and application, I created a game called Crack the MSPQ Code using Genially. In this activity, learners work through realistic registration scenarios, answer questions, and receive immediate feedback as they progress. Gamification was intentionally incorporated to increase motivation while reinforcing key concepts through active participation and problem solving. Module 1 also includes a discussion activity where learners analyze a patient registration scenario involving multiple payer possibilities. Learners use course resources to determine the correct primary payer and explain their reasoning. This discussion promotes critical thinking, reflection, and peer-to-peer learning by allowing learners to review and learn from different perspectives. Module 1 includes an advanced organizer assignment that requires learners to review resources and organize key MSBQ concepts. This assignment helps learners synthesize information while creating a practical resource they can reference during future registration encounters. Module 2 shifts from foundational knowledge to application and communication skills. In Module 2, learners will also participate by reviewing an interactive presentation I developed in Articulate Rise. At the center of this presentation is an animated instructional video that I created using AI-assisted scripting, 11 Labs voice technology, and Adobe Character Animator. This video was designed to simplify complex MSBQ concepts through storytelling, narration, and visuals. Learners can pause, replay, and review the content as needed, giving them greater control over their learning experience and supporting different learning preferences. The Module 2 assignment involves an additional microlearning titled Mastering the MSBQ Conversation, also created in 7 tabs, which includes an AI-generated video, curated resources, and an embedded knowledge check. It requires learners to apply what they have learned to realistic patient scenarios. Learners will review a job aid and complete a reflection that addresses the importance of accurate MSBQ questioning, the impact on billing accuracy and patient experience, and how they plan to apply these skills in their daily work. This assignment promotes authentic workplace application while encouraging learners to connect course concepts to their professional responsibilities. As a key component to the course design, I developed the assessment plan to align directly with both the module and course learning outcomes. Knowledge checks and practice activities are incorporated throughout both modules to provide formative assessment and immediate feedback, which allows learners to monitor their progress while reinforcing key concepts. The course does conclude with a comprehensive final assessment that measures knowledge, skills, and confidence. Learners complete a combination of multiple choice and matching questions, along with a confidence reflection. This assessment evaluates their ability to identify MSBQ questions, recognize common Medicare secondary payer situations, determine payer order, and apply documentation requirements. Including the confidence reflection allows me to measure not only how learners know, but also how prepared they feel to apply the information in practice. To evaluate the effectiveness of the course, learners will complete a 10-question course evaluation based on Kilpatrick's Level 1 evaluation model. This survey gathers feedback on course content, activities, resources, instructional design, and overall learner satisfaction. The information collected will help inform future course improvements and ensure the training continues to meet learner and organizational needs. The MSBQ Essentials course combines microlearning, multimedia, interactive technology, gamification, discussion, reflection, and authentic assessment to create an engaging and practical learning experience for patient access staff. Throughout the course, UDL principles were intentionally incorporated to provide multiple ways for learners to engage with content, access information, and demonstrate understanding. The result is a learner-centered course that supports workplace performance while helping patient access staff accurately complete MSBQ conversations and documentation. Thank you for taking the time to review my Capstone project. I appreciate the opportunity to share my work and showcase the instructional design strategies and skills that I developed throughout the University of San Diego's Learning, Design, and Technology program.